35-year-old Caroline Akello, a breast cancer survivor, shares her experience on how she sailed through the dark days of total lockdown when COVID-19 hit Uganda. Caroline is a single mother living with her daughter Nicole in Nakulabi, a suburb of Kampala in Uganda. She is a member of Uganda Women's Cancer Support Organization and she is currently unemployed due to her health condition. For survival, Caroline relies on the goodwill of her siblings and friends to survive. It was a chance discovery of an abnormal mass in her breast that led to her diagnosis in 2018. Uncomfortable with the mass that did not go away, she sought the advice of friends who suggested that she seeks further medical consultation.
One of them has a friend who is a programs director at the Uganda Child Cancer Foundation. So he told me to go there. When I arrived and showed that gentleman my results, it's called Mr. Benikara, he straight away took me to the director because I explained to him what has been happening and how far I had gone. He took me to the director, but then the director also wrote us a note and sent me to a doctor called Dr. Mugisha Nolib. Dr. Mugisha is the one who asked that he sent me to a surgeon. So the surgeon took the mass, took a tissue from my breast for a biopsy. The biopsy results took like 2 weeks to come back.
The results came back in December 2018. Then followed chemotherapy to zap the cancer.
From January 2018, I started chemotherapy. I finished chemotherapy in May 2019. Then I had surgery in July 2019, and radiotherapy I started in October 2019, but finished in December because there were some challenges with the machines back then. They needed to be serviced, sometimes they would break down, so it went longer than expected. So I completed by 2019 December, I finished radiotherapy.
It was during her treatment process that the nightmare of COVID-19 and lockdown happened.
Many of those that were coming from up country, from far from the treatment center, and there was a total lockdown, it was a nightmare for them.
This cut off continuity of NCD care in patients, many of the patients stopped taking their hypertension medicines, diabetes medicines, cancer medicines. Statistics were showing a drop in OPD attendances because of the reason of stay home, don't move, and something like that. So eventually we started seeing people coming in with complications of NCDs. For example, people came in with heart attack, people came in with strokes and other complications of NCDs.
By then, Caroline thought she had turned the corner with the treatment going well. But as a result of the pandemic, she got complications.
We were all hopeful and we knew things were going to happen. I felt I was better, I had finished the treatment. But then I started having those backaches. Then when I went to see the doctor, they really didn't take it so seriously. They thought it was maybe because of lack of exercise, and they asked me to just take some painkillers, do some exercise, like that. But for the part of the COVID-19, when the lockdown came in, it actually closed most of the avenues that I expected that I was going to get money from. So it was a very challenging year.
With all the financial challenges and the crippling back pains amidst the lockdown, Caroline had to find her way to hospital for treatment.
It was challenging in the beginning, most especially when transportation was closed. No border, because my main means that I would use was border, because I don't have direct taxis to Mulago. So no border, I had to walk. When I would feel I'm not okay, I would walk. But it was difficult. Plus with the back pains I had, that was really a big challenge.
Not surprisingly, she missed a few appointments with a doctor.
The way I think I missed a few, because I had appointments with my doctor for radiotherapy. Because we go back to see a doctor at radiotherapy, and then also the main clinic. But because of that challenge of walking, I missed like twice before I went back.
The bigger impact was us coming here and we wait for our patients and we don't see them. And then you receive a phone call in the middle of the night. I am stuck here in Rukunjiri, ABCD is going on, how can? And you completely cannot help.
The COVID-19 pandemic found Caroline at her lowest moment and with a complication caused by cancer. Twice, she missed her treatments due to restrictions and inability to travel to hospital. Caroline is one of the many people living with NCDs that had to dig deeper into their meager resources to make sure they stay safe from the coronavirus. It was really challenging, particularly to people like her, whose immunity has been compromised by cancer, diabetes, heart disease, and other NCDs.
If you compare the deaths due to COVID-19 as compared to NCDs, then the problem is smaller as compared to the problem of NCDs. Of course, this is a new disease that has taken the whole world by storm. It is something that people had not prepared for, and so there was a lot of panic. And when the lockdown happened, there was interruption of health services, especially NCD services.
Control and containment of NCDs is key in the fight against COVID-19, since people living with NCDs tend to bear the brunt if infected. NCDs are not only a growing problem among the elderly people, but the population of young people discovered with specific NCDs is increasing day by day. Hence, the need to pay them more urgent attention.